So I want to give a update on my journey with Polycythemia Vera. It is February right now, and the past month I've been getting sicker. It's so hard to explain. So I've been taking a medication for a little over a year now, and when I first started the treatment, it's called Jakafi, and it's a JAK inhibitor. I felt incredible. I had my energy back, and my symptoms were improving. Here's the thing with Polycythemia Vera. The only treatment for this cancer is a stem cell transplant. And you can only get a stem cell transplant when you failed all treatments and you have something called like fibrosis of the bone marrow. And it's essentially when your bone marrow stops producing cells because it gets scarred. So at that point, you have to go in immediately for a stem cell transplant. This cancer can also develop into leukemia. The good news is that the percentage of people who develop myelofibrosis or leukemia is very low. But our current therapies of treatment, there are only 3 treatments. 2 of them are highly toxic. And they're essentially chemotherapy, and one of them actually makes you progress towards leukemia much faster. And I'm wondering, like, why would people even take that? So I am on the best available treatment called Jakafi, which is not a cytoreductive. It's not a cancer drug. It is a targeted drug, which helps with your blood cell counts and your symptoms, your constitutional symptoms. And since I've been on this, my blood work has been amazing. It's been so good. I went through 2 surgeries over the past year, and when I did my blood work for the surgeries, I was perfect. It was unbelievable. And I was like, yay, and I talked to my oncologist and I asked, like, why am I so sick? Why do I have these symptoms that are unbearable to live with? And he responded that the blood levels and the symptoms are separate. And he said, you have cancer? And I said, well, wait a minute here. If we have the blood count under control, then I shouldn't have these symptoms. And so basically I have to live with this for the rest of my life. It's chronic. And the only cure is a stem cell transplant. And none of the doctors will give it to me because it is extremely risky. Something called host versus graft disease, but basically what they do in the transplant is they kill every single cell in your body. So it's like you have no white blood cells, no platelets, no red blood cells. So they get you down to this level of, you're basically just laying there like a corpse. And then you get the bone marrow from either a donor or a relative, and it's basically taking their entire immune system, whatever that donor has, that immune system, and it's being put into my body. It's like a completely new person. I am that person in terms of my stem cells, but it's highly risky in terms of the donor stem cells attacking my organs, which you die from that, or it's called graft versus host disease. And so there's a lot of risks with it. But I'm really at a point right now where my doctor and I are doing basically the last thing we can do, and he's going to increase my medication, my dosage of my medication, and we're going to see if this helps. He told me that I'm going to be really anemic, so that's going to put a whole new barrel of monkeys into how I'm feeling. And I don't know what to do. There aren't any treatment curative options. There aren't medications I can take. And I've been spending the past 2 days researching stem cell transplantation, trying to find a clinic or a doctor that would be willing to perform this on me. If I sign a waiver and I'm like, I don't care, I'll die. I don't care. I need to have this done. So I've been on that journey. And it's pretty scary. And I'm looking at clinical trials. I'm researching every single clinical trial for my Polycythemia Vera. I don't know if you could see it or not. You could see some are in Minnesota, Massachusetts, Australia, Arizona, everywhere. I mean, Palo Alto. Hey, that's Stanford. That's my homies. There's so many that are out there, and I'm searching for a clinical trial that could help me feel better, that could cure me, but there is no cure. I'm looking in Italy. I'm looking throughout the world. What is Japan doing? What is Australia doing? What is Italy doing? What is Siberia doing? Nothing is off limits for me at this point. But all of these clinical trials are pretty much based around a medication. And when I asked my oncologist, like, maybe I should start looking, or we should start looking at clinical trials, and he goes, I know what is out there right now, and it's very toxic. So I've been having a really, really, really rough day today. The house right now is 81 degrees and I'm cold. I feel like I have the flu again. This is symptoms that I had prior to starting my therapy. It's having the flu every single day. It's that bone pain. It's the sickness. And it's so hard to force myself to even get out of bed. And I'm trying, I believe the exercise is so important.